Hello, and welcome to this week's Asthma Spotlight podcast. Today I'm going to talk about the ways that inhaled corticosteroid preventer inhalers are prescribed. So to clarify that, I'm focusing on the way that inhaled corticosteroids are prescribed, either as an inhaler on its own or in combination with one of the quick-acting relievers, either in a single inhaler or in separate inhalers. So I did discuss asthma medication in an earlier podcast, and at that time I mentioned that there are different ways that the preventer corticosteroid inhaler drugs are prescribed by your doctor. So if you listened to my talk on asthma medication, you will remember that the preventer drugs for asthma come in three different types: inhaled through an inhaler, secondly, they're prescribed as tablets, and third, they might be prescribed as injections. Now, in this podcast, I'm only talking about the inhaled preventers, which are inhaled corticosteroids, which work against the inflammation or irritation in the air passages of the lungs. So the inhaled corticosteroids are one of those drugs that control your asthma and prevent attacks. And that's why they are sometimes called preventers or controllers. The short-acting reliever inhalers, which are usually blue, are intended to be used only when you get symptoms or during attacks. So today we're talking about the preventer drugs, which, as I said, are also sometimes called controller drugs. The dose or amount of preventer drug that you're prescribed will depend on which drugs are licensed for use and which drugs are available in your country or the area where you live. The prescription also depends on your own asthma and how it affects you, how severe your asthma is, and also how old you are, because there are different doses of drugs for children and adolescents compared with the adult doses. Also, some asthma drugs are only licensed for adults over the age of 18 and some for adolescents and adults over the age of 12 years. So there are three ways that preventer or controller drugs are prescribed. As I say, these will vary around the world and will depend on the way in which the drugs are licensed by the regulators. So in plain English, these are the rules which doctors have to follow when writing a prescription for you. So not all of these three methods will be available in your country. So I wanted to explain these so that you can ask your doctor what options are available for you. Now, before I tell you about the ways the preventer inhalers are prescribed, I need to explain what the two types of asthma drugs do. The one type is a preventer drug, which is also called a controller, and these drugs work against the underlying inflammation or irritation that's going on in your lungs that is caused by asthma. This inflammation causes the air passages to become obstructed or tightened, which cause asthma symptoms. The other type of inhaler is a reliever inhaler, and the reliever drug works by relaxing the muscles that are tightening the walls of the air passages. This is also called bronchospasm or spasm of the air passage walls. So the relievers help to open up the air passages. There are four kinds of reliever inhalers. These are short-acting or long-acting drugs, and there are either quick-acting or slow-acting relievers. The short-acting relievers are all quick-acting relievers, so they work within minutes, and they give relief very quickly. However, their action only lasts for about 4 hours. The quick-acting, short-acting relievers are usually colored blue, and the drug names of these blue inhalers are either salbutamol or albuterol or terbutaline. Okay, so now we also have the long-acting relievers. And these work for between 12 and 24 hours or even longer in some cases. And there are two kinds of long-acting relievers. That is, that they either work very quickly and give relief within minutes, or their relief is slow-acting and could take a longer time before you get relief. The quick-acting, long-acting reliever is called formoterol, and I'll be talking about this particular one in combination with inhaled corticosteroids in this episode of the podcast. Formoterol acts to give relief within minutes. It's as quick as the blue inhaler, and its effect also lasts for about 12 hours, which is longer than the blue inhaler. So for this talk, I'm focusing on the inhaled corticosteroids, either prescribed on their own or in combination with one of the quick-acting relievers, either in one single inhaler or in separate inhalers. So inhaled corticosteroid preventer drugs come in inhalers as the only drug, or, as I say, in combination with other drugs. You'll need to ask your doctor or pharmacist, or check on the information that comes with your prescribed preventer inhaler to find out what inhaled corticosteroid has been prescribed for you and whether it's combined with a reliever, and if so, if the reliever is fast-acting or slow-acting. This is really, really important because the way that you use your medication will depend on what combination you've been prescribed. So I would urge you to make sure that you understand and find out what drug you've been prescribed. So, the three ways that these drugs, these inhaled corticosteroid preventer drugs, are prescribed. The first way is that your prescription is prescribed with advice for you to take the preventer regularly, either once or twice a day, or sometimes more often. Now, the second way that you'll be advised to take your preventer inhaler is called the MART system, M-A-R-T, and this stands for Maintenance and Reliever Therapy, and it's sometimes called SMART therapy by one of the companies. And the third kind of inhaled corticosteroid preventer prescription is called Anti-inflammatory Reliever Therapy, which is also called AIR therapy, AIR therapy. So let's look at these one by one. The first way the inhaled corticosteroid prescriber is prescribed is regularly. So your doctor will advise you to take your preventer once or twice a day to control the inflammation of the asthma. You'll also be prescribed a separate quick-acting, short-acting reliever, and these are usually blue, but not always, and they are prescribed to use for symptoms when they flare up. So it's important to ask your prescriber or your pharmacist or to look at the leaflet to see which of your drugs is your reliever. Now, if your asthma is not controlled on the preventer treatment, the dose of the preventer is usually increased in a stepwise fashion. So in some people, other drugs are added to the preventer to be taken regularly. So either you get an increased dose of your preventer, or your doctor will prescribe an inhaler which has an additional drug in the inhaler to the preventer. Now, this kind of prescribing has been used for over 50 years. Now, if you're prescribed regular medication in this way, that is to use your preventer with or without another drug added to it, and you take it as prescribed, i.e. regularly, it should control your asthma and prevent symptoms and attacks. So ideally, you should not need to use your blue reliever. If you're taking your preventer as prescribed and your asthma is still uncontrolled, then it may be Firstly, that you're not able to use your inhaler correctly, or that you're not taking it exactly as prescribed. So the first thing to do if your asthma is poorly controlled and you're on regular inhaled therapy is to ask your pharmacist or doctor or your asthma-trained nurse to watch you use your inhaler and to check that you are using it in the right way. So if you're prescribed and advised to take your inhaled corticosteroid regularly, that should prevent asthma symptoms, and it should also prevent asthma flare-ups and prevent hospital admissions. However, and this is really a big problem, many people have problems remembering to take medication or even wanting to take medication regularly, especially if you're not suffering from symptoms regularly. And that's one of the reasons why, in the last 20 years or so, that different ways of prescribing inhaled corticosteroids have been investigated and researched. And research has proved that there are different ways to control your asthma and to prevent flare-ups and attack. The other reason why these new ways of prescribing are used is that many people use their reliever inhaler alone for treating their asthma. So they come to rely on regular use of their short-acting blue relievers, and many of these people don't take their preventer inhaler. The problem with this is that when your asthma inflammation flares up and you get symptoms, and there's a risk that this may go on to become a severe attack. Now, in this situation, the short-acting reliever is only good for relieving the tightness in your chest and the difficulty in breathing, which is caused by tightening or spasm of the air passages. However, the blue inhaler does not help to treat the cause of the flare-up. It does not treat the underlying inflammation, so it does not prevent the inflammation from getting worse. And in addition, if you only take your blue inhaler for your asthma without a preventer, and if you use it regularly once or twice a day, it can actually cause the asthma to worsen, and this could be dangerous. So let's talk about the second way that a preventer might be prescribed. And this method is aimed at getting around the problems and dangers when you only take your blue reliever and don't take a preventer. Now, this method is called maintenance and reliever therapy, which is also abbreviated to MART therapy, M-A-R-T therapy. So in MART, an inhaled corticosteroid preventer is combined in one inhaler with a fast-acting, long-acting reliever, which is called formoterol. So with this combination, the inhaled corticosteroid works to treat the inflammation of asthma, and at the same time, the formoterol provides quick relief from the tightening or spasm you get in an asthma flare-up. The other thing about formoterol is that its action lasts for about 12 hours. So to be clear, this treatment may not be suitable for you, and your doctor's prescription depends on your own asthma and how severe it is. So the way it works is that you're prescribed a combination inhaler with a preventer and a reliever all in one inhaler. And your doctor will instruct you to use the inhaler regularly, once or twice a day, for both maintaining your asthma control, which is what the inhaled corticosteroids do, and you'll also be advised to use that same inhaler for relief of symptoms, so you use this inhaler instead of the blue reliever inhaler. I hope I've made it clear that this method is better and safer than relying on the blue short-acting reliever alone. And the reason for this advice is because if your asthma is out of control, you need a reliever to improve the symptoms, but more importantly, you need the inhaled corticosteroid to reduce the inflammation due to the asthma and to prevent a flare-up from getting worse. Now, the third way that inhaled corticosteroids are prescribed is called Anti-inflammatory Reliever Treatment, or AIR, A-I-R. And this is where you'd be prescribed and advised to use an inhaler that combines both an inhaled corticosteroid and formoterol, which, as I said, is a quick-acting, long-acting reliever. And the advice here is that you only use this inhaler when you get symptoms. So you don't use it regularly at all, you just use it when you get symptoms. Now, this anti-inflammatory reliever treatment, or AIR, is only licensed in some countries, about 45 countries at the moment, and it's intended to be used for asthma that is mild. Now, I should say that there's a lot of discussion amongst asthma specialists in the world about how mild asthma is defined, and I'll talk about that in another podcast. About 45 countries have allowed prescribing in this way, and so your doctor may or may not be able to prescribe this for you. So depending on your own asthma and your country's regulations, you would be prescribed only one inhaler containing an inhaled corticosteroid and formoterol to use both for symptoms of cough, wheeze and shortness of breath, and also to prevent attacks from getting worse. The advantage of this way that preventers are prescribed is that you only take the inhaler when you need it, that is, when you have symptoms, so you wouldn't have to remember to take it regularly. Now, as I said, this kind of treatment, the AIR treatment, is only intended for people with mild asthma, and your doctor will decide whether this is suitable for you if it is licensed in your country. So in summary, the key messages from this podcast are: asthma is a disease that is caused by inflammation or irritation inside the air passages in the lungs. The inflammation of asthma flares up at times and causes symptoms of coughing, wheezing, and breathing difficulty. And these flare-ups can get very bad and can result in hospital admission or even death due to asthma. The drug that controls the inflammation of asthma is a preventer or a controller drug, and this is usually prescribed as an inhaled corticosteroid. Now, many people do not follow their doctor's advice to take regular preventer treatment for asthma. Now, this may be because you forget to take it, or that you don't want to take it, or because you only get symptoms occasionally and don't feel you need regular medication. However, this is risky because even people with very mild asthma can die from asthma. One of the biggest dangers is if you only take your short-acting reliever inhaler, which is usually colored blue, for your asthma treatment. This drug does not treat the underlying inflammation due to asthma, and if taken regularly without a preventer, it can cause an attack or it can actually make an attack get worse. Now finally, corticosteroids are prescribed in three main ways. These depend on your own kind of asthma, the severity of asthma, and the prescribing rules or regulations in your country or area where you live. The first way is where corticosteroids are prescribed regularly, once or twice a day. The second, in combination with an inhaled corticosteroid plus formoterol, which is a long-acting, quick-acting reliever inhaler, and this is called MART, or maintenance and reliever treatment, where you take the drug regularly, once or twice a day, and you use the same inhaler for relief instead of a blue inhaler. And the third way that inhaled corticosteroids are prescribed is where a combined inhaled corticosteroid plus formoterol is prescribed for mild asthma to be used as needed for symptoms and flare-ups of your asthma.